pill sort of thing, and the doctors are trained in the same way. But I'd like to get back to something like an analysis of where we are.
Before you get into your analysis, I want to let Jim get in here.
Okay.
He's been overtaken by your caller.
Well, thank you, Reed. Again, the proposal that we really are trying to get to is the H.R. 3200, the proposal before Congress right now. And that 1,000-page bill hasn't been read by our congressmen, our senators, 98% of the senators and congressmen in Washington.
They don't read those bills.
They don't read them, just like they
don't read any of them.
They didn't read cap and trade.
Right.
They didn't
read the Homeland Security Act.
They don't read any of it.
They don't read any of it.
Yeah, I mean, it was passed overnight, the Homeland Security. Now we're stuck with the same apparatus.
And so you have a lot of staff and people who are writing things into them. For instance, on the new health care bill, under Section 431, it says that the IRS must divulge taxpayer identity information, including filing status, modified adjusted gross income, number of dependents, and other information as prescribed by the regulation. It says the IRS must divulge certain tax return details to the Health Choices Commissioner, whoever he is or she is or they are. It says the Social Security Administration can obtain tax data on anyone who may be eligible for low-income prescription drug subsidy, but may not be.
It's pretty invasive.
These are the type of things that are inserted in this thing, as well as, to pay for it. We all know, and it's been stated by several congressmen, that Medicare is going to pay for it.
Okay, I did want to. Okay, we got a call. Good morning, caller.
Good morning. Good morning, gentlemen. An interesting debate you're having here. I wanted to make a point or two and possibly ask two or three, maybe one or two questions, maybe one question. But my main point is that it sounds like the pharmaceuticals are our new King George, and we don't believe in tyranny in this country. It's something to think about. If they have the absolute control that seems to be indicated in terms of our health care, power, of course, corrupts, and absolute power corrupts absolutely. What we need to do, I think, is to offer some significant choices so that all the power isn't residing in one pocketbook or in one venue, in one organization such as the American Medical Association or whatever term you use for that. Ted Kennedy's been trying to get health care reform for 40 years, one of the most effective legislators we've ever had. He was not able to accomplish that. He has tried for 40 years. Something I think needs to be done. I think what we need to do is keep power constantly shifting. The minute somebody gets total tyrannical control, they become dangerous.
Yeah, well,
I think that's true of government, and I think that's true of private enterprise.
Yeah, exactly, caller. But as our guests have pointed out, the healthcare industries, especially, I might add, the 1,300 and some odd insurers, do pay off our legislators. They give them lots of. According to the Time magazine a while back, they gave over $100 million, the healthcare insurers, to Congress to make certain nothing changes. They're collecting huge amounts of money. It's worth $1 trillion a year to them. Well, so they're paying them off, Bubba.
That's an important question. Who owns this country right now?
Yeah.
I noticed that they said that next year our budget is going to be 40% borrowed from the Chinese.
Really?
Now, why is it a socialist country owns most of the United States? Are they so wealthy over there that we, the greatest capitalist country in the world, have to borrow from a communist country?
Well, we're straying now from the health care issue, sir.
Well, I'm talking with
we love the Chinese. They make such wonderful toys for the round eyes.
We're talking about who owns the country and who should own the country. I think we need to keep power from becoming absolute. We've got to watch out. King George has a way of forming unholy alliances. We've got to watch out for the unholy alliances. Okay. I'm going to be quiet and let you gentlemen.
Well, thank you. You cut in on one of our guests, so I'll let you continue now.
Well, again, and the caller brought up an important point of who is in control of what here. The larger companies certainly want to get favorable legislation written in their favor to prevent any competition. And as I said, with 1,300 insurance companies, why can't we open up the doors so that they can all compete on a more equal footing? offer insurance, health insurance across state lines, just like we do automobile insurance. And the other problem that we have, of course, is our federal people want to give money away. And the deficits that are mounting in the face of legislation like the stimulus bill, the $787 billion stimulus bill, and this new cap and trade that has made it through the House that will double our energy costs, and it's going to be paid by consumers. How much more can you ask consumers to pay if you go to single-payer care, which our Congressman Brian Higgins advocates, when it has failed in Maine, Massachusetts, and Hawaii? As soon as something becomes free, we know that the use of that or the demand for that will increase exponentially, and there is just no way that we can offer the type of government-subsidized health care that is advocated in H.R. 3200.
Certainly not on the state level anyway. That's
well, Medicare
sure.
And Medicare is going broke. We know that in 10 years.
You know why? The insurance companies, I mean, your employers aren't paying for your insurance anymore, and they have to go on to Medicare.
Well,
it's right here in Chautauqua County. That is the insurer now for a lot of people. It's the crisis insurance, and that's killing us here in Chautauqua County.
Medicaid is, and I can speak from that perspective. It's a very, very difficult issue because now it consumes 50% of the property tax dollar you send.
And more people are going on it because they're not getting health insurance.
That is correct, and it becomes more and more
And the prices, those costs are, you've got to go back to the pharmaceutical industry, which is basically, charging whatever they can get. But I would like to get back to this conflict that we have, the left-right thing. We've been doing this for a couple of years now, left-right, and when Bush was in office twice, my critique was Bush. He was doing some grotesque things. The war in Afghanistan.
That's Obama's war now. He's doing wonderful
and
things.
That's the point, I mean, this whole thing about Obama's health care package is really a sham because he is right now being situated as a progressive, speaking for the people, and supposedly articulating a program that will resolve some health problems. But they're not talking about the pharmaceutical industry. The language is extremely vague and
Jim pointed out they got to deal with them.
That's right. And what we have in Obama is basically a continuation of the Bush policies. It's nothing else. And this whole thing of a program to address health is a sham. If we look at the most important thing, which is the vaccines that are being developed.
Incidentally, the swine flu vaccine, they haven't proven it, and they're using the old one. And we have millions and millions and millions, tens and hundreds of millions of doses of it. And guess who owned the company who ran it?
Baxter.
Rumsfeld.
Oh, Rumsfeld.
Yeah.
That's a whole other one, yeah.
So you might be right. They might be just scaring the pants off us so they can buy more of that darn
I think it's worse than that. I think it's worse than that. I mean, if you look, there's a great deal of material on the internet, and one of them is this woman, Jane Burgermeister. If you look up Jane Burgermeister, she's an Austrian journalist, Austrian-Irish, and she actually discovered the distribution of the vaccine, contaminated vaccine that was sent. It was something like 64 kilos of vaccine around the world, and it was contaminated. Huh. And what is that vaccine? It's human, pig, and bird.
Really?
And it was manufactured, H1N1, the vaccine that was supposedly were going to be distributed around the country as soon as this pandemic supposedly hits. It's going to be required. If you look at Massachusetts just passed legislation that allows the state to force anyone to take that vaccine. The vaccines.
No.
Absolutely, absolutely. It's on, and that's the sort of legislation that's in the works. And when you look at the laws, the CDC, the Centers for Disease Control, will be able to essentially set policy.
They can do whatever they want to.
Impose a police state, and that is one of the most criminal.
I'm sure you probably buy that.
Well, there are certain aspects to the new national health care that is proposed that gives the government just untold powers, and from taking our tax information, taking our health information, you'll have countless government bureaucrats who have access to it.
Did you hear what the Republicans said yesterday? They said they would also be able to check your registration, and they would probably be hunting out the Republicans, and they would cut their health care so they die.
Well,
that was actually stated, and they apologized for that. They said it was